I think it's the perfect view now.
Yeah, that's perfect size.
Okay, so welcome everyone in this webinar. And before starting, thanks to Tom again for the nice introduction. And as Tom has mentioned, uh, that I hold certain positions, and so I do not have any direct or indirect conflict of interest. But as I hold certain positions, so my thoughts are maybe much more aligned with some methodological aspects and ethical aspects regarding the positions that I hold. So in this webinar, we are actually going to talk about the integrity of the peer review process and journal editorial process for evidence synthesis and systematic reviews. As you know all, that systematic reviews or evidence synthesis that we consider as the most precise evidence or the available best evidence that helps us in decision making, and that helps us in clinical decision making and decision making at the policy level. But alarmingly, we see that sometimes methodologically flawed systematic reviews or evidence synthesis are penetrating the peer reviewed journals. That means even in some so-called very high impact journals or very reputed journals, we see systematic reviews or evidence synthesis. Those are not following the methods properly. So this is concerning because, as I mentioned, there is an assumption that evidence synthesis or systematic review is the best evidence, is the best available evidence that helps us in decision making. So if these are methodologically flawed, then it affects at multiple levels. So we will be discussing those. So from various meta-research studies or from various exploration, it is obvious that many of the published evidence synthesis or systematic reviews are not following the methods properly. So when are we calling it methodologically flawed? So when are those avenues when we should have a red signal that, okay, there is some concern about this published systematic reviews? So there are many aspects when the methodological standard could be breached. So there are key aspects which we consider as the methodological failures. Sometimes we might see evidence synthesis, maybe a systematic review or a scoping review published with a single authorship. So that is very much problematic because by default, the structure of evidence synthesis process, we need a team of different expertise in evidence synthesis. You need information specialists, you need statistical expertise, you need content expert, and at least there are certain steps which are done by two persons independently. So if it is written or published by a single author, that is questionable. Similarly, other avenues where we can explore whether or not they are methodologically flawed or not. It could be an incomprehensive search. So ideally, there are different methodological aspects for searching, including the number of databases or the comprehensive search strategy or transparency of the search strategy, transparently reporting of the search strategy. So this is another avenue where we see that the methodology has not been properly followed. Some other aspects are, as I mentioned, the screening process, data extraction process, risk of bias assessment process. These should be done by two independent review authors. But if that is not done, and if that is not done with any specific rational or methodological streamlining, what we may do in some sort of evidence synthesis, like a rapid review, then that is also questionable. At the same time, sometimes we see there is inappropriate synthesis approach. There might be misuse of statistical terminologies or any other synthesis approach which are not standard method of evidence synthesis. Even sometimes we see that it's an evidence synthesis of effectiveness of intervention, but there is no certainty of assessment or certainty of assessment of the evidence or the using the grade approach for assessing the certainty of evidence. And another important aspect is the declaration of any conflict of interest of the reviewers. So this is somehow mentioned in some cases and sometimes it's not mentioned. So all these considerations might pose a risk with the trustworthiness of the evidence that is published as evidence synthesis or as systematic review. So what could be done in this case? So sometimes AI, because this is the age of AI and AI is being utilized in every aspect of evidence synthesis, that could be helpful, but there are certain limitations also. AI might serve as a second reviewer for screening or maybe for data extraction, but to be honest, till date, there is no validated tool which is established as efficient as the second reviewer like human. So there are many studies which have explored that whether AI tool could be used for screening or whether AI tool could be used for data extraction. Even there are some studies that whether any large language model could be used for assessing the risk of bias. And the results of those studies are really promising. But so far, there is no validated tool, or so far, there is no recommendation that AI could be used as second reviewer. So that might be the future, but at this moment, still we are relying on two human for doing the screening, data extraction, and risk of bias assessment. Even if somebody use some sort of AI tools for screening or data extraction based on the available research, that should be reported transparently. And another thing is the process of evidence synthesis where a team is engaged. As I mentioned, there should be an information specialist, a content expert, statistician, epidemiologist, or depending on the review topic, there might be some other people, maybe some public and uh, uh, patient partners. So the discussion between all these professionals and the conversation. So this is a very much important perspective. And in AI utilized reviews, maybe we will be missing that. But still, it could be a good supplement, but not a substitute at this moment. Then we need to think about the effect of these methodologically flawed evidence synthesis or systematic reviews. We know that systematic reviews are published in peer-reviewed journals. Then those are utilized by the decision-making bodies. And sometimes those are integrated into the clinical guidelines. And also it is disseminated to the public. So if there is a flawed systematic review in this ecosystem, so it has a ripple effect and it will be affecting the whole ecosystem. How it works. As we know that in different clinical guidelines or public health guidelines or in decision-making process, we rely on the evidence synthesis, we rely on systematic reviews. And then there is a process which is known as evidence to decision or ETD. And following that process, decision is taken or a recommendation is being made on a certain topic. For example, whether intervention A is effective for disease B, just as an example. So if we get sound evidence, which is generated through evidence synthesis, following the standard methods, and then if we use a proper evidence to decision framework and we follow that process, we get effective guidelines. And that recommendation might be a strong recommendation, or that recommendation might be a recommendation which is trustworthy and which is with confidence. But if we get methodologically flawed evidence synthesis, and that is considered within that decision-making process, so it might also affect the guidelines if it is not properly judged and if we do not flag the methodologically flawed evidence in the decision-making process, then there might be ineffective guidelines. There might be guidelines that is not trustworthy. At the same time, it has an effect with the public trust because I'm repeatedly saying that we mention evidence synthesis or systematic reviews as the best evidence for knowledge translation also. And if these methodologically flawed systematic reviews are published, and then it also damages the public's perception on scientific integrity. So you understand that it has impact at different levels, both at the decision-making level, also at the public trustworthiness level. And how is it being done? Like, we know that in reputed journals or in standard journals, at least which are not predatory journals, there is a peer review process. There is a strong editorial process. So when a manuscript is submitted, is go through the peer review process, and most of the cases, at least two peer review those, and then it goes to the journal editor, and then journal editor takes the decision. But still, why do we get those methodologically flawed evidence synthesis or systematic reviews? It is going through that peer review process. It is going through that editorial process, but still we are getting those published. So why does it happen? So you know that most of the journals, I think almost all, they have their guidelines, and in their guidelines, they mention that all submissions should adhere to the standard reporting guidelines. For systematic reviews, it's the Prisma guidelines. Prisma 2020 is the updated one, and it has many other extensions, like for scoping reviews, Prisma SCR, or for other types of evidence synthesis, there are other extension of Prisma. But different meta research have shown that these standards are not strictly enforced. One single example I can provide that, as I have mentioned, these are reporting guidelines, and journals strictly suggest to adhere to these reporting guidelines. But you will see many published systematic reviews saying that we conducted this systematic review following Prisma guideline. So Prisma is a reporting guideline. Prisma is not a methodological guideline for conducting the review. So ideally, people should say that we have conducted this systematic review following the standard method, and they can refer to the standard method like Cochrane Handbook or the Cochrane method or other standard methods with reference, and they can say that we are reporting this as per the Prisma guidelines. But you will see those incorrect statements in published systematic reviews. So that is just one example. So as I mentioned, that it goes through the peer review process and editorial process, but still we see this. So it might happen for a couple of reasons. One reason might be is that the peer review process and editorial activities are largely voluntary. So I don't know, most of the cases, the editorial board membership or the peer reviewers, they are voluntarily sought, and many people voluntarily perform these activities. I do myself as well. But the thing is, there is a risk that whenever peer review and editorial board membership is offered voluntarily, there might be a volunteer bias, and maybe sometimes there might be peer reviewers or even editorial board members who are not that much experienced on that specific topic, uh, but still may try to jump in as a peer reviewer or as an editorial board member because this is good for CV. So I'm saying this with due respect to all, but still that might be the actual scenario in most of the cases, because there's thousands of journals and every day thousands of articles are being submitted. So they need a lot of peer reviewers. They also need a lot of editorial board members. So they rely mostly on voluntary responses. And sometimes the persons with expertise or with sufficient experience and expertise may decline to participate in peer review process or in being an editorial board member uh, because simply they are occupied with their own work or did not have time. So this is another aspect where the journals need to think that how to make this balance or how to ensure that peer review process goes through the peer reviewers who are experienced or at least know about the process or about the method. So this is a big concern, and this is also a form of resource waste, I would say, because when we get these methodologically flawed evidence synthesis or systematic reviews published, and that enters into the evidence synthesis ecosystem and evidence to decision ecosystem, that has a huge impact and that affects the decision making. And that's why we should have our solution for preventing this. So I would say this is a synergistic action, and it's not only the responsibility of the journals, it's not only the responsibility of the editors, it's not only the responsibility of the peer reviewers, it also not only the responsibility of the authors or the researchers. Rather, it is the responsibility of all of us. So each one at their respective level should follow the standard methods and should ensure the scientific and methodological integrity. So what could be these solutions? As mentioned previously, that one could be the strict adherence to the reporting guidelines. As we mentioned, we have reporting guidelines for different evidence synthesis, for systematic reviews, for scoping reviews, for mapping reviews, and for other form of systematic reviews or evidence synthesis. Even some reporting guidelines are not yet available for certain type of evidence synthesis, but very soon those will be available. So whenever people are doing evidence synthesis, they should also get updated on different reporting guidelines, and they should be updated according to the upgradation or modification of methods. And another thing, like in this era of AI, what journals could do, that they could use the artificial intelligence to enforce the compliance. And sometimes maybe they can even check the submitted manuscripts with AI tool. So whether it fulfills the minimal criteria of the reporting guideline and the methodological guideline or not. If not, they can just reject it even without sending for peer review. So that might be even the very future where AI will be utilized for at least desk rejection, checking whether the submitted manuscript has followed methodological guidelines and reporting guidelines or not. The second thing is improving the editorial awareness and maybe thinking of some sort of incentivization for the peer review and the editorial process. So it is kind of the responsibility of the journals that they should ensure that the right expertise is in the right place, and they should provide the editorial board membership or editorship or whichever it is to the expert people for the specific topics. And for evidence synthesis, they should seek editorial board membership from the experts who have experience on this, who have methodological knowledge on this. And they can assign this for the editorial board membership. At the same time, it could be provided for the peer reviewers. And the journals could offer regular training for the new editorial board members. I know most of the journals have some online trainings and online instructions, but journals should ensure that the board members, editorial board members, or the editors, they go through those trainings and they actually are trained on those. And maybe they should reduce the reliance on the voluntarism. So I cannot suggest on this, but to be very honest, in my opinion, the journal editorship is a full-time job and it should be a full-time paid job. So it should not be a volunteer job. And that might be applicable. That might help to get proper editorial board members with expertise and experience and efficiency. Similarly, regarding the peer review process, it could be reinforced, applying the same principle that I mentioned about the editorial board members, that as finding the reviewers is sometimes challenging, so journals might prioritize expertise over the availability, and they try to reduce the volunteer bias, specifically for peer review. And they should ensure that the peer reviewers have sufficient expertise on that specific methodology or on that topic. Mm, Ideally, the peer reviewer should have some sort of methodological experience or expertise on that topic before getting it peer reviewed. And similar to the editorialship, there could be some sort of incentivization for the peer reviewers. I don't know what kind of incentivization could it be, but maybe peer review could also be a full-time job for certain journals. And there could be some methodological expertise who can act as a peer reviewer on a regular basis. And also, they should try to train the peer reviewers and ensure that the peer reviewers actually go through those trainings and get the experience and get the expertise of peer reviewing. And it should be emphasized on the methodological knowledge of the peer reviewer before reviewing a manuscript. So overall, the thing that I'm trying to say is that we should be aware of publishing those methodologically flawed systematic reviews and not necessarily tagging or naming everything as systematic review. It's not like that, well, even if it is not a systematic review, but I will try to publish this as a systematic review, so it will make some value. Rather, whichever work it is, if it is a traditional review or some narrative review, it's fine. We should just try to report and publish it transparently as it is. We do not we should not try to publish it as a systematic review or as a specific form of evidence synthesis when it is not. So we possibly know the differences between the systematic reviews and other types of reviews, which we may classify or rename as personal view or traditional literature review, where actually there is no standard method for a comprehensive search or dual independent screening or for assessment of risk of bias or for appropriate synthesis or for even assessment of certainty of evidence. And other aspects that I mentioned, even within evidence synthesis process, sometimes many people they use different methodologically without following the standard process. For example, using quality assessment tool as risk of bias tool, or even using very old obsolete tools, for example, the score-based tools for assessing risk of bias assessment. So these all are the form of not following standard method of evidence synthesis. So what I wanted to share with you is that we should uphold the scientific integrity, and it's a shared responsibility. We have the responsibility as a researcher. Whenever, as a researcher or systematic reviewer, we are doing the evidence synthesis or systematic review, we should make sure that we will follow the standard method. And when, as a peer reviewer, we will be peer reviewing a manuscript of evidence synthesis, we should make sure that we will peer review that following the standard method. And similarly, as a journal editor, we should make sure that before accepting that manuscript for publication, we should make sure that the methodological standards are being maintained. So let's do it together and let's prevent the research waste and maintain scientific integrity. So that's all from me. And I will hand over to David. David, over to you.
Thank you,
Thanks.
Saif. Okay, I'm gonna okay, so I think what I'm going to talk about is more the sort of the base issue of manuscript peer review. Um, and I do realize in asking this question that um, you don't have a thumbs up, so you can't sort of tell me whether you do it or not. But sort of based on my previous experience, when I asked an audience of, let's say, 100 people, um, probably 90% of the people put their hand up and sort of say they are participating in some aspects of doing manuscript peer review. And I think that's wonderful. You're giving a very large donation to the publishers, and in terms of 2020, this data it's 100 million hours, and so you can sort of look down on the left side. I've just given you some information about what that is by country, but it's an enormous donation. And I'm sure the publishers are super delighted with that donation. And what do the publishers give you back for that? Well, I think I'm being very diplomatic when I say not so much. And I get a lot of peer review requests every day. And anyway, you could look at this paper, and what it indicates is that journals pretty much give you nothing for your time and effort. And so that just contributes to their profits again. And so the question I would next ask an audience of 100 people is how many have formal training in manuscript peer review? And generally, I get maybe one hand up, maybe one and a half hands up. And so that lots of people do this, and not so many people are trained in manuscript peer review. And so I always sort of have a bit of a joke. If I was asking this audience of 100 people, how many of you would like your colonoscopy by somebody trained or untrained? And, people laugh and they say unanimously, oh, we want somebody trained to do our colonoscopy. And so, in a sense, this is a double standard. We allow people with no training to do peer review. But if it's something clinical, oh my God, we have to have somebody who's really quite well trained. So, from my perspective, it's a terrible double standard. And so, what these four papers are, they're actually so-called systematic reviews. These are four systematic reviews that are actually looking at whether peer review as an intervention, whether it works. So, and I say so-called, the one on the sort of bottom left indicates that it's a network meta-analysis. And, I've shared it with some experts in networks, and I think we could all agree that probably not a network meta-analysis. The point I want to make is that for an activity that we spend 100 million hours a year doing, there's approximately 20 studies that have actually looked at whether peer review is effective or not. And because I don't have time today, I think what I can say is peer review effective? Not so much. Not so much. And so if you're a clinician, what would happen if you use interventions that are ineffective? And so there's obviously professional and systemic risks. You could obviously face, professional criticism, legal risk, etc. The actual ecosystem itself would become very inefficient. It would, as Saif has mentioned, it would probably lose trust. And that would be also problematic. And also, the use of ineffective interventions can obviously lead to patient harm, and obviously wasted resources, etc. So we don't allow this to go on clinically. We do absolutely allow it to go on for manuscript peer review. So what are the harms of manuscript peer review? Well, I think as all of us would know, it can take a very, very long time to get an answer from a journal. And if you're at a journal, it could take you going to 50 people to actually get one or two peer reviews. You could get manuscripts rejected, and that might mean, in some cases, a loss of promotion, definitely in some cases, a loss of being able to get a degree. And unfortunately, editors are unfortunately have received threats of violence, including death threats, because for some publications, they are so important for promotion and tenure. And yet we sort of know that there is this terrible disconnect between actually what peer reviewers do to evaluate things versus what journal editors are asking peer reviewers. And so that's a bit of a problem, to say the very least. And I think Seth has also mentioned AI, and in the context, at least of Canada, where I live, this is a really big issue. I think it's safe to say that this systematic review, it's not a systematic review, please forgive me, it's a cross-sectional study. And there are actually no policies in place about the use of AI. And that's a huge lack of responsibility on the part of research performing organizations. It may be different in other countries, they may be better, but it may not be. I don't know. So the question is actually, what is manuscript peer review? And it depends where you go. If you look at the International Committee of Medical Journal Editors, they have one view of what it is. If you look at publishers such as Taylor and Francis, they have another view of what it is. And so there is actually no agreed upon definition of what manuscript peer review is. Remember, this is something we spend 100 billion hours a year doing, and there's no agreement on what it is. Now, I want to come back again to clinical medicine. If you look at something like atrial fibrillation, there are international guidelines. This is what atrial fibrillation is. But somehow, a peer review, it doesn't matter. We don't really need to know what that is. That is hugely, hugely problematic. So what can you do? Well, there's probably some things that you can do, excuse me, and take individual action. And then there might be some things you can suggest your system, your ecosystem can deal with. So I think the first one that, again, Fife had mentioned is you can actually go and take some online training opportunities. And if you actually go to the journal website, you can get to see we have web links for all of them where you can go and see. Now, as much as that is important and as much as journals have done stuff, you should know from this paper that lots of them are behind paywalls, and so they're not easily available. And also the sort of the training opportunities that are available on average are about 10 or 15 minutes. I'm not sure I want somebody to do a colonoscopy who's been trained for 10 or 15 minutes. I think I want something a bit better. But maybe others differ, and they're quite happy to have somebody who's been trained for 15 or 20 minutes. So if you go to the journal website, you can get all of these, and you can actually just see what's out there. These are all that are available online. The other one is you could use, as Saif mentioned, you could use reporting guidelines. again, I'm not going to produce lots of evidence here, but the evidence that's out there indicates that editors actually don't give peer reviewers reporting guidelines to use for doing for helping facilitating in manuscript peer review. So there's a reason for that, and I'll come to that. And you can go and get a view of reporting guidelines on the Equator Network. It's open source. You don't have to pay anything to get access to any reporting guidelines checklists to facilitate a manuscript peer review. And you can get all of the all of this Prisma extensions, as Saif has mentioned. And the other thing that you could do, and I think Saif has nicely alluded to this, is you could take a course on research integrity. And I would say do it. At the University of Ottawa now, for all incoming graduate students across the university, they are required to take 2 modules of a research integrity program. Now, you might think, wow, they can get away with it. Actually, they can't. You can't get an email address unless you take the courses, the modules, excuse me. So I think that's good. And I think it should be a requirement to have research integrity. And I'm going to come to why that is. So this is a really nice study. It's a very simple study. It's a very elegant study that Ben Goldacre and colleagues did. In essence, what they did is they looked at 5 so-called high impact factor journals over a 6-week period, and they identified 67 randomized trials. And what they found is problems in 58 of them. And here's just simply one example. 365 novel outcomes were reported without declaration. Is that research integrity? Perhaps not. And if we look here, a nice piece again, looking at the professionalism of peer review and what these authors have showed in examining nearly 1,500 peer review comments, that 41% of them contain complete, inaccurate, or unsubstantiated critiques. So again, not so professional in how we're doing a peer review, but perhaps from my perspective, not so surprising as well. And so this is a lovely paper. I love the title. I wish I could have the title myself. A lipstick on a pig. Here are some examples. This is a recent paper. Here are some examples of don't do this when you're peer reviewing. The writing of this paper is atrocious. You should look closely at a career outside of science. Come on, where is the research integrity here? It's just lacking. And so I really think we need to train people, not so much on peer review, but also on research integrity. What could the ecosystem do in a bigger way? Well, in Canada, for example, we have an Equator Canada publication school, maybe once every 18 months. Perhaps in Galway they could do that. Perhaps in Galway they do that already, and I'm not aware of it. And this is something that is really fantastic. An opportunity. This goes on in Berlin. Berlin have something called perspectives, and they actually have a PhD course on peer review, and that course can be used towards your PhD. But perhaps that's something that Galway University of Galway could consider, or Evidence Syntheses Ireland as well. And I just wanted to sort of end with a couple of points. This is some work that we did a few years ago about developing core competencies for scientific editors. And why did we do it? Because there aren't any. And so that's the point. This is for the first time a set of requirements for editors. And actually, maybe we want to think of something like that for peer reviewers, or maybe we want to use a model, at least in Canada, of how they train physicians. Should we do that for peer reviewers as well? I believe so, because I think it's a critically important function, and we shouldn't have untrained people doing that. This is from, I believe, this year, meaning 2026. Journal retracts 150 articles for compromised peer review. This was in, I believe, the THE, Times Higher Education. Linguistic snobbery in peer review hurts new researchers. So, these are not esoteric things. These are real things. And I thank you. I'm going to stop sharing, and I'm going to hand it back, I think, to Tom.